when you look at with regard to ventilation for the respiratory system, the components are going to involve the conducting system and the alveoli. That's the respiratory system, right? So the trachea, the bronchi, remember they branch 20, 30 times, something like that, and they end in these little microscopic structures called alveoli. And it's at the alveoli where we're trying to get the air into and out of to allow for gas exchange. To do that, we need to be able to generate this pressure gradient to allow for the air to move. The way we generate the pressure gradient is by altering the volume of the thoracic cavity. The way we do that is by pulling on the ribs and changing the structure of the abdomen. So that would create volume change. So we need muscles, skeletal muscles to do that. Right? So if we look at this, we do have muscles that are important in ventilation. So for ventilation, let me just give you the order of events of things that happen. It's kind of a misconception. People think that you know when you take a big deep breath, you can feel your chest rise, right? Now, here's the question. Is your chest rising because air is moving in? Or is air moving in because your chest is rising?
Air is moving in because your chest is rising.
Right, right. So it's not, if the air was causing it to move in, that would be what we would call a positive pressure breathing. Like, that's what happens if you give somebody CPR. You are physically blowing air with a high pressure into their lungs and causing their lungs to inflate. Here, we make our lung volume increase first, and that causes air to move in. So here's the order of events. Always, always, always. First thing that happens is that muscles contract. Okay. Pressure changes. Oh, let's do this first. Volume changes. And then pressure changes. And then the last thing that happens is air moves. Okay. So this is our order of events that happens during ventilation. Muscles contract, so we have to stimulate them with action potentials down motor neurons, releasing acetylcholine on nicotinic receptors on skeletal muscles, which causes excitation, contraction, coupling, and power stroke cycling, whatever the muscles contract. Okay. When the muscles contract, they pull on the ribs or change the shape of the abdomen, abdominal cavity, and that changes the volume of the thorax. If the volume goes up, the pressure drops and air moves in. If the volume decreases, the pressure goes up. Did I say that backwards? I lost my train of thought. If the volume, what did I say first? Let's do it this way. Let's just start over. If the volume increases, the pressure drops and air moves in. I can't remember if that's what I said, but that's what I meant to say. If the volume decreases, the pressure increases and air moves out. Okay. You with me on that one? Decrease in volume, increase in pressure. Increase in volume, decrease in pressure. And that's because of Mr. Boyle. Right? Boyle's law says that pressure and volume are inversely proportional to each other. Right? So that in this case right here, if P1 is greater than P2, V1 must be less than V2. So they're inversely related to each other. So here we're changing the volume first. If we drop the volume, or if we increase the volume here, we have to decrease the pressure. If you decrease the volume, you increase the pressure. So that's what generates the driving force, if you will, here. This pressure gradient is changes in volume. Okay. So here, if we decrease the volume, you have to increase the pressure. If you increase the volume, you decrease the pressure. And this is all relative to what? Atmospheric pressure. So if the pressure inside the lung goes up, it's now greater than atmospheric, and air moves out. If the pressure inside the lung goes down, it's now less than atmospheric, and air moves in. And the greater we change the volume, the greater we change the pressure, the more air will move. Does that make sense? And that's Boyle's law. Now, so the question then is, how do you change the volume of the thorax? You change it by contracting muscles that move ribs, or by contracting abdominal muscles that are going to push organs up into the diaphragm. Okay. So what are the muscles then that we would contract that would increase the volume of the thorax? These are the muscles on this side of the diagram here that are muscles of inspiration. These are the antagonistic pairs of muscles that are muscles of expiration. And it's pretty simple, right? Here, I'm going to ignore the sternocleidomastoid and the scalenes because these are very minimal. So they create minimal changes in the size of the thorax. And the reason they create minimal changes in the size of the thorax, look what they're attached to. To the clavicle, if you pull up on the clavicle, you're barely changing the volume of the thorax. The first rib at adulthood is actually fused to the sternum. It doesn't move. Okay, so that's not going to do anything. And this little second rib right here is barely attached by the scalene, so when it gets pulled up, it's only going to slightly change the volume. But the muscles that really change the volume of the thorax are these external intercostals and the diaphragm. Okay. Now the diaphragm is easy to understand because it sits like this, separating the abdominal cavity from the thoracic cavity. When it contracts, because of the way it pulls, it flattens out. So you can see right here, if I flatten this out, what just happened to the volume of my thorax? It went up, right? So that's going to be contracted to increase the volume of the thorax and to allow for inspiration. The external intercostal muscles sit like this, between ribs. Okay. The origin is superior, the insertion is inferior. So when it pulls, it's going to pull the ribs up. And because the way the ribs, if you look at that skeleton back there, because the ribs project anteriorly and inferiorly, so down like this, when they get pulled up, they get pulled out. Right? So when you contract those muscles, your rib cage gets pushed out. So the diaphragm flattens, the rib cage gets pushed out, the volume of the thorax increases, and you inhale. And then what do? I relax those muscles. The volume then decreases back to normal, and I exhale. So normal resting breathing is called eupnea. Eu means true. Pnea refers to pressure. Eupnea is just passive breathing. What you're doing right now when you're sitting there breathing is you're contracting intercostals and diaphragm, relaxing them. Contracting them, relaxing them. Right? You're not contracting muscles to exhale. It's just the relaxation of the inspiratory muscles. And the amount of air you move when you do that is about half a liter. So about 500 milliliters of air is what you breathe in and out at rest, just sitting there. Okay? And all you're doing is contracting and relaxing those muscles we just talked about. Now, if you want to really, so right now you're breathing, if I say inhale more, can you? Yeah, there's something called an inspiratory reserve. Okay, so how do you do that? You need to make what? The volume changes even greater. So we would super contract these muscles, if you will, right? And we would send extra signals down here to really pull the ribs up, to really flatten the diaphragm, to have a greater volume.